Hi, everyone. We'll give you a moment to roll in, coming in from that previous session. It's time for our first session on whole person care in action, treating beyond the symptoms with Kyle Braatz and Dr. Jeff Glad, who I'd love to invite on stage now. Kyle Braatz is the co-founder and CEO of Fullscript, the leading care delivery platform for whole person medicine. Kyle co-founded Fullscript in 2011. Under Kyle's direction, Fullscript quickly became an innovator in healthcare technology, now serving over 100,000 healthcare professionals and over 6 million patients in the USA and Canada. It is closing in on $1 billion in annual revenue. In 2023, Kyle joined the Ottawa Senators Group, adding hockey ownership to his resume. This opportunity has accelerated his greatest passion, helping others. Kyle and his wife have actively partnered with the Ottawa Senators Foundation, driving programs that align with their values and adding to the $4.5 million they've already helped raise to date for charitable initiatives that matter most to them. Welcome, Kyle. Next, I'll introduce Dr. Jeff Glad. As Chief Medical Officer since 2019, Dr. Jeff Glad advises on company and product direction with the perspective of integrative and family medicine. Dr. Glad graduated from the Indiana University School of Medicine in 2001, and after successfully opening a family practice, he shifted focus toward health-promoting care by completing the University of Arizona Integrative Medicine Fellowship Program under the direction of Dr. Andrew Weil, and in 2009, in opening the Parkview Health Center for Integrative Medicine. In 2010, Dr. Glad opened GladMD Integrative Medicine, blending health-promoting care with high-access technology. In 2011, he created and launched the web's first nutrient depletion calculator, mytavin.com. With the success of GladMD and mytavin, Dr. Glad has become a sought-after speaker in his field, speaking at TEDx and being featured in various industry publications. Thank you for being here, Kyle and Jeff. We are so excited to learn how Fullscript is redefining healthcare and empowering providers to deliver truly comprehensive whole person care. It's my pleasure to hand things over to you.
Well, thank you for having us and welcome everyone. It's obviously great to be here. I'm honored to share the stage with Dr. Jeff Glad, our Chief Medical Officer, but I also do want to let everyone know that I'm pretty mad at him. He's supposed to protect me against all of the germs that come home from my doctor's SK class, and he hasn't been able to do that. So I'm starting this off with a head cold, which I partially blame him, our Chief Medical Officer at Fullscript.
There may be some practitioners in the audience that could help you better than I. That's awesome, Kyle. It's great to be here. We love talking about Fullscript, but we really love talking about the mission that we're on, and having this many practitioners in the room to present to, is something we honor, and we're glad to be here. We want to really focus on a topic that's at the core of everything we do at Fullscript: whole person care. And it's the approach that moves beyond the traditional symptom management and helps practitioners get to the root causes of what's going on with their patients. Many of you have taken extra education, extra training to learn more about supporting your patients and your patients' health. We want to have the platform that allows you to deliver this easily, so that more of your time in clinic is spent actually in connection and relationship with patients, and not researching and clicking and doing all of the administrative burdens that usually are part of practice.
So, why am I standing in front of you? I look back, it's probably not because I'm qualified or any other reason. It really starts back when I was 16 years old. As Avita declared, I had a love for hockey, the outdoors, and probably getting into trouble, which hasn't changed, as Dr. Glad can probably share with you, as all the mischief we get to at Fullscript. And I think if you would have told me back then that one day I'd be giving a presentation to providers about whole person care, I really wouldn't have believed you. I didn't even really know what that was. I think at that time I had my future all planned out. I was going to be a firefighter just like my dad. I grew up within that culture and I loved it. I loved the camaraderie and really the sense of purpose. But my parents, before jumping right into the fire service, my parents convinced me to go to the university first, and they knew that whatever my plans might be, an education would probably be helpful, even within the fire service. And then, a funny thing happened along the way. At school, I started not for profit to honor my granddad. I treated it like a business and raised over $150,000 for the Canadian Cancer Society, cycling across Canada. Then I started a real business, grew it, sold, and asked, what's next? What's next for me? And for me, looking back at all these things, what was next had to be something that could make impact. And I think, at Fullscript, helping people get better and doing it at scale is something that I feel really passionate about. And that's kind of the story as to why I'm standing here in front of you today.
And I came to Fullscript. I mean, Avita kind of walked through the bio, but essentially, I mean, I was a busy primary care doctor in small town Indiana, delivering babies, covering ER shifts, doing inpatient medicine, and really lived the burnout lifestyle. Not to mention was taking SSRIs out of the drug rep closet to manage panic attacks since medical school, and realized that I needed to change myself. I didn't know what that meant. and so, started a journey of better nutrition, lost 50 pounds, got off of medication, and really realized that what I did to reverse my health, I didn't learn in medical school or residency. It was all self-taught. And so I needed to go learn this stuff. So, as mentioned, went to Dr. Weil's integrative medicine fellowship and realized this is actually a way to practice medicine. It's a completely different paradigm of meeting patients where they are, getting to their root issues, and took off from there. Came back, had joined the local hospital system the year before, again, part of that whole burnout story, and got them to help start an integrative medicine program. And I loved the practice. Had a little bit of protection in the first year until then. Now, all of a sudden, the production standard was going to kick in. They came to me a year in and said, Jeff, we love what you do. You've got a 6-month waiting list. Can you see 3 times as many people? And I knew where that was going to take me. And so spun out in 2010, started our own practice, which I'm still in today. So I'm sitting here today in my practice. I still see patients 2 half days a week to be sort of the alpha tester of all the features that Fullscript brings. As mentioned, started the nutrient depletion calculator, and that really connected me to Kyle and sort of saw the vision that Kyle had for whole person care, bringing technology to these practitioners to really optimize the care they were delivering, and just love every minute of it. So Kyle, let's jump into kind of why they're here and where we want to take this.
Yeah, look, I think the reason everyone's here is we all share that same purpose and the goal of making impact. And we all believe in the power of whole person healthcare. I think that's true, but we also realize how the struggle is real when you're working within a healthcare system that makes it harder and harder to put patients first. And Jeff, you mentioned burnout. Like, provider burnout is at an all-time high across, every practitioner. Really trying to find that balance between how do I accelerate and build bottom lines while driving better patient outcomes. Because both need to coexist. And I think the reality is patients are feeling it too, right? With access to more data than ever before and all of these consumer-like solutions, but they have less ability to decipher it and they have less support in their journey. And when you look at the data, really, you can't blame either side for being tired, right? Or feeling like their tanks are empty, because just look at the numbers here. It's 4.5 trillion in U.S. healthcare spending. Around 95% of it's going towards largely preventable disease and mental health outcomes. So we're sitting here saying it's not a matter of money. The money's there. It's just being spent inefficiently or too late in the process. The money's focused on the prescription before prevention. And it's leading to a system that's not only failing patients, but failing all of you, failing providers, and providers are burnt out. And you look at the burnout stats, 50% of providers report feeling stressed, 20% report feeling depressed. These are some of the statistics that obviously keep us up at night, but they're also the type of statistics that get us out of bed every morning. They're the things that excite us because we know there's so much change that needs to happen.
Yeah, and again, those are just the statistics. We've had so many conversations, and some of you probably have had these conversations either personally or with colleagues. Practitioners are overwhelmed by this system that just makes it harder to do what we went to school to do, which is provide care for our patients. I obviously lived it. I mean, I was there 20 years ago, again, 40 patients a day, and doing that grind with time in that patient visit, enough time to refer or prescribe a medication. And again, getting into integrative medicine and still staying in a hospital system, we just couldn't figure out a way for me to do that in a way that I had the work-life balance. And we're seeing practitioners now in droves looking for better ways to take care of patients. And as Kyle said, patients have never desired it more. And whether that's really helping patients get to their root concerns, or it's looking for new models of care, both at the practitioner level and the patient. So we all know there has to be a better way, and it really starts with getting beyond symptom management. Kyle, you want to define how we view healthcare at Fullscript?
Yeah, I think that's one of the advantages probably I had with my co-founders starting this business in our guest bedroom is we didn't really look at fitting ourselves into a healthcare system. We asked ourselves, what should the healthcare system look like? And that kind of really allowed us to develop a thesis around the things that we believe. And, we believe that healthcare should be focused on the whole person. It should be preventable, health promoting. And that means incorporating nutrition, supplementation, lifestyle change, maybe pharmaceuticals when necessary, surgery when necessary, but all driven by personalized and comprehensive diagnostics. We believe that healthcare is not just a point of time. It's too often when you live within the healthcare system, people look at the acute issue and try to solve that one problem, but healthcare is always on, and it's a journey for the patient. It's not episodic. And then ultimately, we have a belief that it's best with the support of a provider. And you see so many solutions out there trying to come forward and say, hey, we can solve all of this with AI and ML and work directly with a computer, when ultimately for someone to get better from our perspective, it's best, with that provider. And in other words, we call this whole person care. And when I look at, what we're doing at Fullscript, our objective, we hope to be leading that kind of whole person care movement. We believe that if we can create a better care experience that incorporates all of those beliefs, we can help create better care outcomes. And that's ultimately what we all want, is better outcomes for our patients and our clients. And the way we're doing that is we're creating an ongoing cycle of whole person care, leveraging the Fullscript platform and our partners.
Yeah, so I'll jump in there. I mean, when we talk about this sort of ongoing cycle of whole person care, we really think about 4 stages. And as you'll notice, if you're a Fullscript user, stages 3 and 4 are the original always on value props of Fullscript. Stage 1, though, is really capturing patient data. So the demographic data, now lab data and information that you're testing patients on, or that patients have done on their own, and they want to bring that data in. Analyzing your patient's medication and ingredient lists and what they're currently taking, teed up to help you make better decisions. Next is taking another step toward those decisions, which is helping support with personalized patient plans. So we're able to quickly turn this context into ingredient-based, evidence-based supplement plans that have, attention to potential interactions, knowledge of what they're currently taking, and the dose adjustments you may want to make, or different forms of supplements that you should reconsider. And so as we then bring in those high quality recommendations, and we use the adherence management tools that Fullscript is providing as an extension of your care, we can keep patients on this lifelong journey, and this cycle continues, right? You repeat the data, you measure that up against what they're doing and how they're feeling, and start all over and continue that care cycle and that whole person care experience.
And I think when you look at this care experience, that we actually not only believe we can create better care experiences and care outcomes, but we're starting to prove it, which I think is really exciting, right? That was the thesis: create better care experiences. Can we create better care outcomes? And we have early signals right now that we are moving in that direction in partnership with all of our practitioners.
Yeah, spot on. So, I mean, we're out to partner with all of you, right? All practitioners who have this passion for whole person care to set a new standard of healthcare. And as you know, standards of care can't just be statements, that there have to be outcomes that support what's being done. So it's why we partnered with Dr. Cheng Ran at the Texas Center for Lifestyle Medicine last year and did a 6-month retrospective study of that practice's use of Fullscript, but also the impact on the patient care. And so you see on the left-hand side, the engagement tools of Fullscript really engaged those patients and connected them better to that practice. So patients who received the Fullscript treatment plan versus those that did not were 73% more likely to have a follow-up patient visit. That's not with the doctor, that could be with the health coach, the dietitian, that was with their IV clinic. So just that extra touch and connection to patients made a big difference. We then looked at patients that had at least 2 biomarkers done within that 6 months, and patients who received the Fullscript order are on the left column. Patients who did not order in Fullscript are in the center there, and you can see the significant biomarker difference, whether it's folic acid, zinc, B12, triglycerides, iron. All those patients saw improvements in those markers, and the patients who didn't order on Fullscript actually got worse. And so you look at that sort of percent based on where they fell within the reference range. We're showing the impact, and this isn't necessarily the actual supplement plan. This is your plan and the engagement that Fullscript provided to get the patients to get better.
And I think we've always had a vision of being more than just a supplement dispensing platform, right? I think even in the name Fullscript, it's kind of the essence of we want to power whole person care. We want to help support the Fullscript. And I think that's why we're excited about, what's next. It's funny, when we started the company, I probably thought we'd be in this position after 3 or 4 or 5 years. You're always optimistic as an entrepreneur, but it really took us, 12 years to build a platform that is fairly world-class in one specific area and really earn the right to expand and offer more value to our customers without taking away from the experience we've created. And I think that's where we're at today. And I think, the first thing that I wanted to bring up was just that, moving from supplements to now supporting lab testing. We know how important lab testing is from a whole person care perspective, but we also realized how that experience could be so much better. And we took big steps throughout all of last year to integrate labs as a starting point into Fullscript in the US. And we're really excited to see the value it's bringing to practitioners and their patients. And we hope, in the future here, we can also bring that same sort of value to our Canadian practitioners. So stay tuned there. And really exciting news for everyone here is that we are going to be bringing labs on Fullscript into the Practice Better integration with availability expected around mid-year. So until then, practitioners can still access the value of labs in Fullscript, but the integration is going to be next level. I think taking that labs solution to the next level and kind of piggybacking off that is we wanted to create as much value as possible, as quick as possible. And for us, that the acquisition of Rupa Health allowed us to bring together the industry's most trusted lab companies into a single integrated platform. So that combination is really bringing together the most trusted lab companies in the industry, streamlining the testing process by giving providers a single place for now recommending, managing, and reviewing lab results. And obviously our catalog is going to be growing even faster than planned now that we have Rupa. But I think when you think about the testing catalog, it's really only as good as your ability to turn lab recommendations into results.
Yeah, and this is a busy slide, and I would sort of not try to read the whole thing. I wanted to just kind of showcase this to practitioners that are on today who are current Rupa users. If you've been using Rupa, which is an elegant solution, similar to Fullscript in being able to minimize the number of accounts and dashboards and logins that you have to manage in your clinic, Rupa did a great job there. As we talk about this integration, we've got teams every day and night working on this integration to make sure that we take the best of both of those worlds and really bring it together in an elegant platform. Our rule when we do anything like this to the practitioner and the patient is do no harm. And so we won't do anything until we know with absolute certainty that this is going to be a very smooth transition for both the practitioner and the patient. And so the assessment phase was really looking at the best of both platforms. How do we bring the best of Rupa into what Fullscript has so that we can really give an excellent experience for the practitioner and the patient? Then as we start, as the course of the year goes on, we'll start taking sort of small groups of cohort practitioners, moving them over, again, white glove service to make sure that that transition is incredibly smooth. Rupa and the data there will be available as read-only. So you're not going to lose any data. It'll all be brought into Fullscript, but your backup then will be Rupa Health. What I want to talk about, though, is really where we're going with labs, and Kyle alluded to it quite a bit. But as a practitioner, I know that I've had this experience firsthand a lot, how frustrating it is to piece together lab data from different sources, ordering from different sources. But now with labs and supplements in one platform, we're going to make whole person care more scalable and effective than ever before. Providers are going to be able to recommend, manage, review the lab results all in one place. We're building the clinical tools to help you quickly visualize those results, gain insights from those results, maybe beyond what you've looked at or understood. And maybe it's just a backup for you. Again, you've learned all this, you have a knowledge base. We're going to be bringing in the evidence, though, that supports maybe additional insights that you hadn't thought about. We believe these better lab insights are going to lead to better supplement plans, which ultimately leads to better patient outcomes.
And I think when you think about what we're doing at Fullscript beyond labs and supplements, we have so many exciting new tools that I think are really going to help providers save time and scale whole person care. And I think one of the first and more practical innovation is the currently taking feature that's available in the mobile app for patients. Even the most personalized supplement routines, they don't work if patients can't keep up with their doses. And really this tool helps solve that challenge, as you've seen in your practice, Dr. Glad.
Yeah, absolutely. So the currently taking feature, really powerful in the patient mobile app. They have the ability to basically scan barcodes of the supplements they're taking, and all of that moves into Fullscript. And realize that's not just supplements from Fullscript. That's the entire NIH labeled database available in the platform to allow patients, that are getting supplements from anywhere, online, their local pharmacy. We're going to pull all that ingredient data and dosing into the platform for the practitioner to view what the patient's actually taking. So you get the convenient place to track supplements and medications for patients, but the practitioner gets the view of the current regimen. And that's a powerful tool. I'll move on to the next slide and kind of show you what this feature looks like. But as the patient is easily capturing their complete daily routine of supplements, and we're seeing patients, we now have a medication list and patients are putting their medications in. I now have a reminder as part of my get ready for your appointment next week to my patients to please populate their currently taking list and their medication list. My patients are coming to me and saying, I love this feature. I now have this in my app. When I show up at other specialist office or my primary care doctor's office, I just print this list out for them. But me as a practitioner now gets this consolidated view of all the ingredients they're getting. So one of the biggest ahas I had in early days when I was using this in beta, I hadn't seen a patient for about 2 years. And he was doing better, 2 years ago, and wanted to make an appointment because he was having some digestive issues. I asked him to populate his currently taking list, and we sat down in that visit and I walked through his list, and I found that he had ran out of the calcium and magnesium that he was taking previously and just went to CVS and grabbed what he thought was equal. The ingredient list populated for me showed me that the magnesium form was magnesium oxide and the calcium form was calcium carbonate. That immediately set off a red flag for me, knowing that those are very poorly absorbed minerals, but they're also associated with digestive issues. And so we were able to now move him back to a higher quality product for both calcium and magnesium and successfully addressed his digestive issues. So we know patients who are engaged with their plans stay on their plan. So as Kyle said, if you could have patients really populating this list, it's helpful for you as the practitioner, but it's really helpful for the patients as they're able to maintain that plan you're putting them on.
Yeah, I think this is exciting. I love the currently taking feature. I use it as a patient myself. Another thing that I'm really excited for is the assistant, and how can we support providers, writing plans and taking all of this patient context from currently taking to lab results to all these other things that they're seeing about their patient, and how can we help them do their job, more effectively and efficiently.
Yeah, so you moved right into the next step of the care cycle, right? The plan writing assistant. And so this is one that we're really hard at work on, really, really excited about. Currently, we use the Fullscript Assist with the Compare Everywhere feature. So, as a practitioner, based on your ingredient intent, you have the ability to pull up a compare of 4 similar products where we're going to be able to show you which one has the highest adherence rate by patients, which one has the lowest cost per month, but also have the full ingredient breakdown, allergens. So you've got a full view and choosing the perfect product for that patient. Coming down the road is the ability to use the patient context, right? That demographic information, that currently taking list, all of the lab data, and really support treatment plan creation, not only just based on the evidence of what you're up against and what the patient's dealing with. We're also going to layer over that the nutrient depletion data so that you may see medications they're on and a need for higher B12, say, or drug nutrient interactions. So that, again, the safety of your recommendations is also going to have high confidence for you. This is all powered by AI, but every step of the way, the Fullscript medical team is part of this. They're researching this, they're reviewing all of this. So we're taking a vast amount of the published data to help support your delivery of whole person care.
I love it. And I think that's one of the things that I'm always so proud of at Fullscript is when you look at the evolution of AI and everything else, it's how important it is to have trusted support across the board when you're talking about patient and client health, and to have our Fullscript medical team, a practitioner in the loop. All of these things are so critical as the world evolves so quick with these solutions. And we talk about, evolving quick. One of the things that I'm just blown away by is, the fact that we started with the goal of helping, one practitioner at a time, and we've grown to a place where we're now supporting over 100,000 practitioners of all different modalities, impacting millions of lives. And even though we're here, I always say it feels like we're just getting started. And I think that's exactly where we're at. And together, ourselves, Practice Better, this community, I really feel like we're going to make whole person care, the new standard. And this, to me, is more than just a movement. It's really the future of healthcare. And we're standing at a moment, a pivotal moment, where whole person care can really be the key to turning the tide on preventable disease, provider burnout, and that patient engagement that we described earlier.
That's right. And again, like the momentum alone of the patient demand isn't going to get us there alone. The purpose of the practitioners and the desire of the patients isn't going to get us there. It takes innovation and inspiration to really transform the system. And it takes the collaborative effort of Fullscript as a technology platform, but the practitioner. So, Kyle and I want to hear from practitioners. We spend a lot of time with practitioners trying to learn how can we better help them? How can we optimize that care? And that's really what we're delivering to you. We're excited to present this. All right, so we're going to open up the floor to Q&A. I think Avita's going to come back with us. I will turn my screen share off.
Thanks, Dr. Glad and Kyle. That was incredible, and I couldn't agree more that the future for whole person care is so exciting. Let's get into our audience's questions, starting with Tiffany. How does the Fullscript prices compare? I want to ensure my clients are getting the best deal. Otherwise, why recommend it?
Yeah, it's a great question. It's one we agree with you. And the thing you have to realize is it starts with the quality benchmark that Fullscript has set for the catalog we have. So we have a one-to-one relationship with every single brand that's on the catalog, which means we're constantly vetting to make sure that they meet these high quality standards, these potency standards. There's third-party testing involved. And then that moves to our distribution centers. Our 5 distribution centers around the US are NSF audited and pass audit every year. So again, that quality metric and that benchmark is high. We're now testing products off of the distribution center shelves to add another layer of high quality testing. So if you can talk to your patients about the quality, that certainly secures the Fullscript catalog. From a pricing perspective, you will see some of these products and some of these brands out in the retail market. Let's use Amazon, for example. They have moved to Amazon to sell direct to the patient, but the one commitment they maintained to the healthcare practitioner was that they will sell at MSRP or above MSRP. And so we encourage all our practitioners to put at least a 10 to 15% discount on their Fullscript account. Talk to your patients about quality And if they go to Amazon and look for that brand, they should make sure that they purchase it from the brand store on Amazon, or else you're getting who knows what, right? There's all kinds of proven data on doctor products, counterfeit products, added ingredients. You're going to find that the patients are going to save 10 to 15% on average compared to what they would get out in the retail market. So we feel really strongly that this is not only a significant quality elevation for your care, it's also savings for your patients. If your patients then subscribe to auto refill because your intended duration is longer than a couple months, they get an additional 5% off. So this is significant savings. There's also the ability and the encouragement to use FSA or HSA funds to purchase supplements because these are your recommended treatment plans. Additional big savings on the products that they're getting from Fullscript.
That's a really good point about those additional savings. Thank you for that answer. Hopefully that helps, Tiffany. Question from Monica. Do MDs get a better list of things available for our clients and certain brands that health coaches do not?
Yeah, I can take that one too, Kyle. So yes, but this is all based on the brand. So each brand has their own commitment to a certain level of practitioner, and we just honor what that brand stands for. Now, the majority of health coaches have, I would say 90% of the catalog available to them. There's only a small number that focus more on licensed practitioners. But again, that's a small number. And if you have any questions about, I really can't get this one on Fullscript, the brand is limiting me, our medical team will find, very equivalent, if not almost perfect matches of what is available to them to be recommending out of that high quality catalog.
Okay, excellent. From Dr. Tejeda, is there a way for a provider to update the patient's currently taking list?
Kyle, you want to handle that? Because I think you have a really opinion, strong feeling on just empowering the patient, but also doing it under the care of the provider.
Yeah, I think one of the things that we think a lot about is go back to that belief of the healthcare as a journey, and it's a journey that patient is on. And ultimately, the way we look at currently taking is it's really information for the practitioner to be able to educate the patient, right? So if a practitioner sees that, this patient is taking these 5 or 6 products, they can communicate to that patient and help them make an educated decision, meaning, to Dr. Glad's point, the forms don't make sense, or you don't need this product. It's a waste of money because you're getting these ingredients through this protocol. So right now, we do really believe that at the end of the day, the doctor is going to make recommendations, but the patient's going to go on their journey. They make decisions throughout that might change, and having that information is really the most important thing for the practitioner. Ultimately, we do see a path that in the future, maybe there's start, stop, continue type of functionality within the platform. But for now, that's more of a manual conversation. And we're just trying to make sure the practitioner has the insights to be able to educate that patient.
Makes sense. Excellent. Our next question is from Tracy. Will more lab companies be offered that were part of Rupa?
Yeah, that's exactly that. That's part of sort of the thesis behind the acquisition. That was the one thing we heard a lot from practitioners as we started to launch labs inside of Fullscript is I need a bigger catalog. I have a certain microbiome test or a certain hormone test I want to focus on. And that's part of that assessment is looking at that catalog, looking at the utility and how many practitioners were using these tests. And we have ongoing conversations with all of these lab companies, which have been very, very positive. The lab companies are incredibly excited about this partnership, about where we're going with labs, about where we're going with whole person care. So rest assured, if not the entire catalog, the vast majority of that Rupa catalog will be available inside of Fullscript.
Fantastic. I know over at Practice Better, our community is so thrilled that with the acquisition of Rupa Health and what's coming next and the direction of the lab integration. Question from April is, did Jeff say that the lab data from clients already tested via Rupa will populate over to Fullscript so that we can see the trends?
Yeah, that's exactly right. So all that data is going to move over in that patient information. We'll also be notifying the patient of that. So if they're looking at their data, they know where to access that. But as the ultimate backup, Rupa will remain in a read-only state for both parties to be able to kind of see that data. But, and again, we'll be white gloving the whole service. So if you're noticing, hey, some of this patient data didn't move over, we want to address that right away and figure out if that's a systemic issue that we need to solve for, but we certainly want to take care of you as the practitioner.
Another question related to kind of like US and state is, I have noticed that FSA and HSA was denied from my patients. Is this based on state?
Not that I'm aware of. I mean, again, the IRS sort of federal rule is medically necessary supplements qualify right away for HSA and FSA funds. So I would say the vast majority, 90% of my patients, print out the treatment plan that I sent them to justify the medical necessity. 10% may need additional clarity, in which case we have sort of a template my staff takes, move that treatment plan onto that template that says this is medically necessary. They bring in the diagnosis codes that are in the EHR, and we've never had a rejection. Again, I don't think that's state-based. That may be plan-based. But if you look at the IRS requirement, all of those it's all met.
Okay. Another question from Melly is, would more NSF products be coming for specifically sports nutritionists? Also, I love the latest webinars about sports nutrition. Yes, Fullscript has incredible content, especially educational stuff out there. So I'll hand that over to you, Dr. Glad.
Yeah, no, we're jazzed about sports nutrition. We think there's an incredible opportunity to continue to grow that. We are partnered with a number of brands that have NSF for sport products. We're talking to other brands, to continue to fill that catalog. So absolutely. And again, if there are products or product lines you're missing, let our team know. We want to explore that. We want to provide providers with what they need to care for their patients best. But we also do, if you search for an ingredient, the filter on the left side allows you to choose a filter for certifications, and you can choose NSF for sport and see the entire catalog and what's available to you today.
I love that you're giving guidance of how to do it yourself, but also how to connect with your team. What's the best way to connect with your team if our members, if our community, our audience watching right now has further questions about Fullscript?
Yeah, Kyle, you want to talk about the commitment to customer service? I mean, you've been very, involved in that from day one.
Yeah, I mean, look, when we built the company, we said there's two things that we have to do really well. We have to create a really strong user experience in the software and a really strong user experience when it comes to support. And if you do that, then everything else will be easy, marketing, sales, etc. So we have our customer service team where we hold the team to extremely high standards. And one of the things that I'd say right now, if you're not getting that high standard, like my email's kyle@fullscript.com. I still stay connected to all of the practitioners that use our platform. I do calls all the time to help, take in the feedback around what we're doing well, what we're doing wrong. But look, support@fullscript.com is going to get the quickest answers. If you're not getting what you need, kyle@fullscript.com. We have a whole team of account managers that are focused on how do we help you optimize and leverage Fullscript? What are all these new tools and features? How do they fit my practice? Because the reality within healthcare is every single practitioner practices a little bit differently and has different needs. And so, Fullscript is not this monolithic beast that you have to use everything available. It's one that we can really help fine tune to get the best, for you and your practice, as well as, you and your patients.
Super. I can vouch for Fullscript's excellent customer care. And also, if you haven't signed up for Fullscript's newsletter, the information you get there is fantastic. You need to watch those webinars and tune into that. I have a question for Dr. Glad from someone in our community is, what advice do you have for practitioners who are new to integrating labs and supplements into their practice, but want to get started with a whole person care approach?
Yeah, it's a great question. It's one of the other exciting aspects of the Rupa acquisition. I mean, having Rupa University now as part of Fullscript and their entire educational platform and boot camps, everything they've done to educate a practitioner on using labs for whole person care, it is now going to be blended into our educational content. So Rupa University right now is still a standalone site. I would go engage there. We have built a lot of supplement education. We partnered with A4M to do the sort of supplement certification course. So 20 plus hours of CME to really dive into the full evidence base behind a core number of supplements to start in your practice. And you can itemize that if you want, or take the whole course. And we have the Rupa podcast, the Root Cause podcast, which is also a great place for education, what's happening in the industry to help you get started. But the starting education has been a really new passion for us. So we're now seeing a lot of interest out of conventional healthcare systems, conventional practitioner groups. And these doctors are telling us, we get it. We want to do this. We didn't learn this in medical school or residency, similar to my story. So we're now building the education for that starting point. And so keep, like Avita said, sign up for the newsletter, pay attention to everything happening coming out of the education channels at Fullscript, because we hear you and we want to start this educational journey with you.
I love that. That education piece is so important. So on that note, there's another question. It's asking, some providers struggle with educating patients about the benefits of whole person care. So how does Fullscript support practitioners in delivering patient education efficiently?
Yeah, so we have built a huge resource library of professionally authored content with evidence links to support everything we're saying, written for the patients. All of those are available to attach to your treatment plans. And that goes beyond supplements. It certainly talks about the quality of the supplements, why we may have recommended magnesium, but there's stool tracking for IBS, there's elimination diet guides, there's Mediterranean diet guides. So again, if you're starting out, utilize those resources. Again, patients really get them, they really appreciate them, but also realize if you're a seasoned practitioner and this has been part of your practice, you've built a bunch of content, upload those as PDFs to Fullscript so that when you write a treatment plan, your voice and your education is supporting those treatment plans as well.
And I think, Dr. Glad, correct me if I'm wrong, but there's a new analytics dashboard in the platform that gives really strong insights around what you're seeing when it comes to patient conversions and different things. And there's also links to some education that, we have so much data around what works and what doesn't and how practitioners speak to their patients. And so we have a link in there that kind of describes all of the best practices for getting results with your patients and clients.
So much.
Yeah, I mean, we want to power the practice as well, right? And the practitioner. And so we realize sort of this gap of, giving practitioners these insights only goes so far, right? It's more the insights, right? You can give the practitioner the data, but what are the insights telling them? How is their, clinic working? How are their treatment plans being converted? And then we want to be able to support that. And so we're building a lot of content around that as well. I find, talking to my patients about the quality story of Fullscript is a really powerful tool. I think it also starts with the currently taking feature, right? Getting them before their first visit to upload everything they're taking, which none of that is going to come from Fullscript, most likely, gives me then the ingredients to start talking about, like, what source of magnesium are you taking? What's your form of vitamin E? How much fish oil are you actually taking? And is it clinically meaningful? And so it sets up that visit to really have this really strong, powerful quality conversation and realize quality is, yes, it's purity and potency, but it's also dose and form, right? Is this meaningful to your health journey? And so that currently taking feature really opens up a lot of conversations, and it saves patients from bringing 2 giant bags of pill bottles and me having to pick each bottle up and review each label and try to do all this mental math, which Kyle knows I'm terrible at, and really starts the conversation. And guess what the patient wants to do? Let me know what I need to take, right? And that's the easy navigation right into Fullscript, the catalog. You can show them the bottles. They can easily make the connection of, okay, this is where I want to be with my health journey.
Exciting stuff. We have some folks in the chat who are confused about the Rupa acquisition. Do you mind just taking the last minute to tell us more about what Fullscript has been up to in the last year related to Rupa and what's coming next?
Yeah, I mean, so I think it was October 8th or 9th, we announced that of 2024 that we announced that we had acquired Rupa Health, and we were combining, Fullscript and best-in-class supplement platform with the best-in-class labs platform. And so the goal here is over the next, 6 to 9 months, we will create a seamless integration path and bring everything under the Fullscript umbrella. So one platform to do to cover all of your needs when it comes to supplementation and lab ordering. I think Dr. Glad kind of alluded to it. For the people using Rupa, there's going to be a seamless transition, account transition, patient transition, data transition. And we have a good track record of this. We've done this now 2 times in the past with Natural Partners and Emerson Ecologics and their patient direct platforms, where we've been able to seamlessly, make that transition easy for both practitioners and patients.
Thank you so much, Dr. Glad and Kyle, for your time with us today. And we'll see you in the next session, everyone.
Thanks, everybody.
Thank you.